Welcome to the sixth and final module in the Visionary Board Leadership Program. My name is Shannon Studden, and I'm a Senior Program Specialist with the National Rural Health Resource Center, a national nonprofit organization dedicated to improving and sustaining the health of rural communities. We've covered a lot of ground in this program. We've looked at what value-based care and population health are all about, and explored the role that a clear, compelling vision can have on your facility's successful transition to value. We've talked about the partnerships and communication strategies that are integral to a unified approach to population health across the community. In our last module, we explored ways to ensure that current and future employees, and in particular current and future leaders, have the skills and experience needed to carry your organization into an ever-changing healthcare environment. In our final module, we'll build on the ideas from the previous module by looking at ways that you as a board can direct others toward your vision for the future by creating a culture of accountability within your organization. Just as in past modules, other leaders will be joining us to tell their stories and share how they've done this in their organization. Also, as in past modules, we'll give you a few things to discuss together as a board. So let's get the conversation started. One role of a rural hospital board is to delegate authority to the CEO. When a board delegates authority, it means that the CEO has power to make decisions, allocate resources, and direct the work of others in ways that are aligned with the strategic direction set by the board. When a board delegates authority, it doesn't give up accountability for outcomes. This means that it's important for you as board members to create an environment where the board and CEO have a shared understanding of goals, regularly review progress toward these goals, and provide each other with feedback on a regular basis. When there's agreement on overall direction and desired results, it allows the CEO to make operational decisions in line with strategy and frees board members up to focus on the big picture and long-term vision for the organization. Things you can do as board members include set clear expectations, measure progress and results, and work to build a culture of feedback. Let's look at each of these in a little more detail. In the relationship between a board and its CEO, strategic planning serves as the foundation for expected outcomes that the CEO is being asked to achieve. The board sets the vision and identifies strategic goals, and then delegates authority to the CEO to carry out the activities he or she deems necessary to achieve them. Many organizations also set individual performance goals for their chief executive. These often address behaviors that facilitate achievement of the vision or strategic goals, and may include things like maintaining strong relationships with medical staff, providing continuing education for the board, and collaborating with community partners to support the transition to value. Any expectation-setting conversation, whether between the board and CEO, or between a department manager and his or her staff, is most meaningful when approached as a collaborative conversation. When both parties have input into the final product, the person being delegated to often feels a stronger sense of accountability for outcomes. These conversations also provide an opportunity for you to ask your CEO about his or her expectations for you as board members. You might ask questions like, how can we best support you as you work toward these goals? And what do you see as the right level of involvement from board members in your work?
We have a formal once-a-year evaluation of Mary Ellen. I think we all so close in a way. With our CEO, I'm talking about the board members. We're not a community with 200,000 people. If somebody has a problem, they'll probably call me on the street or something, and I would hear and I would know what was going on to a large extent. If I have a problem with something, not often, Mary Ellen, we have a difference of opinion, I'm going to sit down and talk to her about it, and we're going to resolve it. I don't know, these annual evaluations, I guess you need them and they're good, but I think you're almost evaluating at every board meeting. And we'll make suggestions.
In the process of our board implementing policy governance, accountability was a key factor in that. They designed the policies to indicate that the CEO of the organization is their only employee, and they delegate the power to that executive to make pretty much most decisions within the organization as long as they're within the limitations that they define for that individual. And so if quality scores drop or some other unfavorable event happens within the organization, I am the one that they hold accountable for those events. By clearly defining that, it sets expectations for myself and also expectations that I have for staff in what we need to do to be successful and the objectives that we need to reach.
We developed a tool for his performance evaluation, and it's done annually. There's a subjective portion that looks at how he's done with certain skill sets that are necessary for his job. We also then have more concrete goals, and we look at the HCAP scores and the long-term care report card and the bottom line as well. And there are also opportunities for comment, and then we go through that evaluation process, and Erin and I sit down and discuss it, and then we present the results to the board.
If your organization has a strategy scorecard or evaluation plan to gauge progress towards strategic goals, this may very well serve as one means of measuring your CEO's successful achievement of outcomes. Your board should also conduct a performance review with your CEO on a regular basis, annually at a minimum. This serves as a mechanism for measuring achievement of individual performance goals and behaviors. It's important to identify a method of measuring each set of expectations. However, we want to point out that measurement doesn't always have to be numeric. Many organizations limit the number of rating scale questions on performance reviews, but place more stock in the comments received, as this qualitative form of measurement provides a much more detailed picture of the CEO's behavior and performance. So after agreeing upon expectations and measuring progress and results, it's time to close the loop by providing feedback. Feedback provides an avenue for recognizing desired behaviors and outcomes. It also provides an opportunity to change behaviors and activities that aren't aligned with an organization's strategies, goals, or values. But feedback does even more than that. When an organization has developed a culture of feedback, where giving and receiving timely feedback is a regular part of everybody's job, it results in higher employee engagement, a greater sense of accountability, stronger relationships, and a continuous improvement mindset shared across the organization. A culture of feedback creates an organization that is well prepared to respond to changes in the environment, such as the transition to value-based care. The most effective feedback is specific, focused on actionable behavior and results, is provided on a regular basis, not just once a year at performance review time, and is used as an opportunity to have a collaborative conversation that results in feelings of investment in and accountability for results. When your board and CEO incorporate feedback into conversations on a regular basis, it helps create mutual understanding, builds stronger relationships, and sets the stage for a culture of feedback and accountability to develop throughout your organization.
Some people might call it walking the talk. But it's very important in healthcare to be very consistent with the things that we do. And we talk about that with high reliability in the sense that we have this evidence-based protocol, but if we don't carry that out every time in the same fashion, then we're not going to get the outcome that we know is going to occur by the evidence for that protocol. So we work a lot with our staff to be consistent, and part of that consistency, though, is to make sure that we hold people individually accountable for doing that work. And that means there has to be some auditing and oversight, and we call it just-in-time coaching. If you see something, you say something, but to me, a culture of accountability is that people are going to do what we say we're going to do, and whether that's values or policies or protocols.
How can we move the needle on outcomes for whatever it may be that we're looking at? But it's making sure that you're talking about accountability, but not just paying lip service to it, but also making sure that you're measuring it. Because what you measure is what you actually work towards. So it's not a punitive culture. It's here's where we are. How can we all get better? How can we do this together? And making sure that we're providing education, team steps, we use just culture, all of those things that go along with creating a culture of accountability so that people feel safe talking about what they aren't doing as well as they could be, and looking at near misses, et cetera. But it's really making sure that you're measuring your move towards whether that's growth, financial, patient experience, patient quality, whatever it is, it's making sure that you're measuring it and then that you're having discussions about it at the departmental level and figuring out how you can do better. And of course, they're responsible for strategic planning, and so they're highly involved at that level. And then how are we doing? Our agenda is set up along our strategic plan, so we have pillars that we talk about each board meeting. And then at finance committee meeting, we're really looking hard at our finances and, are we meeting our benchmarks that we said we were going to be meeting? And if not, why? And are we providing the services we need to provide? And so we really have candid conversations. And if we didn't, I think the board would be, they would ask, like, well, what happened to the dashboard that you used to have for us? And, and our board meeting, our full board meeting, it's not just me and the board and the CFO. We have nursing, we have compliance, we have facility, we have IT, we have marketing, we have HR. So everybody's there and they're giving a report. We have medical staff, so we have a CMO, and it's sort of a dyad leadership model, although that's not formal. It is the way that we operate, and so that CMO comes to the quality meeting as well. So we just have really, robust conversations, and where we show we show the good, the bad, and the ugly.
Here are some questions for you to reflect on and discuss at your next board meeting. What processes do you currently have in place for setting expectations? Board expectations for the CEO and CEO expectations for the board. Processes for measuring progress and results, and processes for providing feedback. What, if anything, would make these processes even more effective? And how can you use these processes to help your organization be successful and navigate the transition to value? And here's something for you to consider doing. Based on your responses to these discussion questions, develop a plan for implementing changes to your performance management processes and embedding them into the way your board and CEO work together. Well, we've reached the end of the Visionary Board Leadership and the Transition to Value series. In this series, we explored fundamental concepts of value-based care, visionary leadership and systems thinking, building collaborative partnerships, communicating with impact, succession planning and employee development, influencing performance, and inspiring accountability. You heard from other rural health leaders and hopefully had some valuable discussions with your fellow board members. We hope that you leave this program feeling better prepared to lead your organization through the transition to value. For additional resources and information on the topics covered in this and all other modules in the series, see the resource guide that accompanies this program by searching for Visionary Board Leadership within the Center's resource library. And for even more tools and resources to help you in this transition, check out the Rural Hospital Toolkit for Transitioning to Value-Based Systems on our website. We at the National Rural Health Resource Center are also always available to answer questions or provide any additional resources. Please contact us anytime for further assistance. We sincerely thank you for joining us throughout this series and wish you the best as you continue your important work in rural health.